What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Doing wonderful. Thank you, everybody, for joining us once again. This week we have something interesting that Bryan and I are going to discuss, and we're both men, but we're going to delve into the female anatomy a little bit and talk about uterine fibroids. So I've seen quite a few patients with uterine fibroids, and they can be really ruin your quality of life. And we'll go through it here briefly and give you ideas of how to mitigate, control, possibly cause regression, possibly cure yourself of them with natural lifestyle modifications as well as natural medicines.
So first of all, Keoni, why as a man, why is it important for me?
It's important for you for a number of reasons, for both of us for a number of reasons. Number one, being healthcare providers, right? And uterine fibroids can show up to a PT as back pain. Actually, I have a couple patients where that is their main complaint, back pain. It also can show up as anemia. And then the other reason why it's important for men to understand this is that at some point in a woman's life, I think the estimate is up to like 75% of women can have uterine fibroids.
Interesting. Okay.
Yeah.
So it's
So
prominent.
it's a big problem. It's a big deal. So I think it's really good to know. A lot of actually some uterine fibroids, you can feel them in their lower abdomen. I mean, because some of them are so big and causing problems, and that can be a little bit nerve-wracking for a woman, especially if she doesn't know what that is,
Yeah.
right? But uterine fibroids are certainly not nearly as serious as cancer. They are benign tumors, so they are not serious as cancer that can spread or be aggressive or anything like that. Although with that being said, one of the questions that comes up about uterine fibroids is, since they are a tumor, is there a chance for them to, maybe change into being cancerous where they can spread throughout the body? And there's a very, very small chance that may be the case, but usually they are benign, and most women don't have to really worry about them, other than, as far as cancer goes, other than like kind of mitigating the symptoms that go with them. So we're going to talk about it and get into talk about why they're so common, and hopefully give some women some help besides what conventional docs do. And one of the mainstay treatments for uterine fibroids is just to have them removed. And again, you can see how this may be an issue, especially if a woman is of reproductive age and is thinking about having children. Of course, you don't want to have your uterine fibroids removed, because the most common way of having it removed is to just have your uterus removed, have a hysterectomy. So that is certainly not an option for a lot of women.
Yeah,
And
it's been a running theme here with our gallbladder episode, the just remove it philosophy that we kind of talked about too with some surgeries.
yeah, and that's what it is. And we'll get into ideas of why they go that route. But it is one of those things where if you can keep your equipment, it's best to do so.
Yeah, absolutely. Keep your anatomy in
Yeah.
all instances if you're able. Absolutely.
If you're able.
I am curious, Kenny, and to what degree you can speak to those studies or examples or whatnot. I don't know, but for those examples you were giving where maybe possibly it does turn into not benign, it's more serious problem that starts in or leads to cancer growth in other areas of the body. I'm curious, is it like a chicken before the egg type thing? Like, do you know if in those instances they had cancer first and then it spread into these uterine fibroids, or would that not happen?
So that's a great question. I can answer it from just a little bit I know about it, right? So from my understanding with uterine fibroids, there are a very small percent of them that can have cancerous tissue in them, right? Now, that cancer tissue is kind of, from what my understanding, is wrapped within the fibroid. So it's kind of safe within the fibroid, from what I understood. All right. Now, yes, there's always a chance it could break out of the fibroid and cause problems. I don't know of any information on that, of that ever happening, but here's what we know. There is a procedure called, I hope I'm pronouncing this right. It's called more celeration. Let me see. Let me just make sure I'm getting this.
While you're looking that up,
Yeah,
Keoni,
go
go
ahead.
ahead. No, yeah, if we got it.
I found, yeah, I found it. Well, anyway, it's called more cellation. So more cellation. So MORCELLATION. That is a procedure that they've done on women. And basically, from what I understand about this procedure, is they go in with instruments, think laparoscopically, or maybe up through the vaginal canal, through the into the cervix, and it's almost like they put like a blender on the fibroid and like chop it up into little pieces. And what they found in a small percentage of women, that by doing that they spread cancer throughout their body. So, and that's horrific, right? And they
Yeah,
didn't
yeah,
realize that, these fibroids had cancer in them. So this is a procedure I think is still being done, but it's fallen out of favor because of this small chance of that happening.
yeah.
So as far as like uterine tissue and the fibroids, some being cancerous, then this is where I think this presents itself. So then that speaks to the fact that a lot of docs just want to, remove the fibroid instead of the whole fibroid, instead of like chopping it up and then let the body like degrade it and get rid of it.
Well, I think quickly we should kind of mention or talk about what a fibroid is, because it's just
Yeah.
a growth of basically
Yep.
cells, and then primarily it's muscle cell and connective tissue. So
Yeah.
you can see why what happened in this place. I don't know if you get fibroids other places, but you can see why it would, that surgery maybe has fallen out of favor.
Yeah. Right. So yes, so uterine fibroids, as name implies, fibroids found within the uterus. So yes, you can get different like benign tumors in other areas of the body. They're called leiomyomas is the medical term, and they're just non-cancerous growths of the uterus. All right, and it's of the uterus, and a leiomyoma, a myoma that is indicating that it's like it's a growth within the muscular wall of the uterus, right?
Mm-hmm.
And so, there are intramural fibroids, and these are fibroids that grow within the muscular wall of the uterus. And then there's submucosa fibroids. These are fibroids that grow toward and into the uterine cavity. And then there's subserosal fibroids, which grow outside or within the uterus, but grow out towards the body cavity. And then you have cervical fibroids. So those names just depend on where they're found in and around the uterus. And they are just tumors, benign tumors of the uterine wall. And the thing about the reason why they're so predominant and so common is because they also are chock full of estrogen and progesterone receptors. And the female anatomy, especially the reproductive equipment, is full of those receptors. So this is why a lot of women get them throughout their lifetime, because anytime there's estrogen and progesterone surges and anything, you can cause these tumors to grow. So in a study of I think women between like 35 to 49 years of age, the incidence of uterine fibroids, I think by age 35 is 60% among African American women. By the way, African American women are 3 times more likely to have uterine fibroids than women of Caucasian descent. So, but so by age 35, 60% among African American women, and then it increases to 80% by the age of 50, whereas Caucasian women show an incidence of 40% by age 35 and almost 70% by age 50. I mean, that's a lot of women, right? So up to 75% of women, as we stated, will have a uterine fibroid at some point during their lives. And then most of the time, Bryan, they do not cause symptoms, but they can cause a lot of symptoms, which we'll go into here, and it runs the gamut, right? So if it's within the uterus, right, you can think of, well, the uterine wall, every month a woman of reproductive age sheds her uterine lining. Possibly these uterine fibroids are going to cause excessive bleeding. Absolutely correct. Yes, prolonged menstrual bleeding can be indicative of uterine fibroids. Depending on how the uterine fibroid is growing, if it grows into the uterine cavity, then you may have issues with getting pregnant, may have cause miscarriage issues. If it's like a subserosal fibroid where it grows out, towards the body cavity, like outside of the uterus, then you may have issues that cause back pain, or it can cause urinary issues, frequent urination or incontinence, possibly constipation, and then also back or leg pain. The few women that I've seen where the fibroids were really causing problems, they came in with back and leg pain. Also they had horrific, menstrual bleeding too. So if you have really prolonged menstrual bleeding, what's one of the things that's going to come up? Well, they're probably going to be anemic if this is going on month after month. And so it's always good to run a CBC and just check that and make sure that that is being taken care of also. And women can have one fibroid, they can have multiple fibroids. They can be all over the uterine wall. And they can, just cause a lot of pain and suffering. And as you can imagine, a woman of reproductive age is probably, thinking about having children at some point, and definitely has a desire, if that's the case, to maintain fertility. So a lot of the conventional treatment options, especially hysterectomy, that's not an option. That's just not going to be an option for them. And then one of the treatments, like if the main symptom is prolonged bleeding, then one of the main treatments of that is to give them estrogen and progesterone, right? Well, that kind of doesn't make intuitive sense because, well, I guess in one hand you can control the bleeding with those hormones, but in another, you also may increase the growth of the fibroids, right? So when bleeding is an issue, sometimes they'll treat with hormones. When it's not an issue, they usually, it's usually a surgery thing to remove them. There are other ways to remove the fibroids besides just pulling all the uterus out. There are treatments where you can go in and just try to get the fibroid itself and remove it. There's called uterine artery embolization. It just disrupts the blood supply to the fibroid and decreases the size. It can really help women in the short run, but a lot of these treatments that just go after the fibroid instead of taking out the whole uterus, a lot of times they'll grow back. So, you just have to, pick what treatment you want. This is one of the reasons why me and you want to do this podcast, is because we want to give women an option for, okay, well, if you're of reproductive age, if you're thinking about having children, so removing the uterus is not an option, then maybe using like one of these treatments where like a myomectomy, where you just remove the fibroid as well as use it in conjunction with natural therapies, that may be the best way to go.
So you would do the surgery and then you would prevent it with the natural.
So what you can do,
so you're going to list off as well.
So if you are doing like one of the more non-invasive surgeries for uterine fibroids instead of the hysterectomy, you can, you're going to have better outcomes, better results by doing some of the natural treatments that we'll talk about here in just a minute. So if you're just removing the fibroid, not removing the uterus, doing that in combination with natural treatments is going to make it better. That's all I was trying to say.
I understand. Yeah.
So what other risk factors? Well, we talked about one. African American women have approximately 3-fold greater risk of developing fibroids than Caucasian women. That's been studied. And one of the reasons why is because African American women tend to have higher levels of aromatase enzyme. And what the aromatase enzyme does is anytime there's a secretion of testosterone in the body, and yes, women make testosterone, African American women tend to convert that testosterone to estrogen quicker and more, and they're more efficient at doing that. And so they get, they're just produce more estrogen, and probably their estrogen receptors are more sensitive. So that may be one of the reasons why that's happening there. Also, body weight is a big issue. Women who weigh more than 150 pounds have 3 times the risk of developing fibroids than women weigh in less than 100 pounds, which is interesting.
Answers all, you want to be somewhere in the middle, not that sounds like those extremes again.
Right. But also think about, like, the more fat you have, fat converts testosterone into estrogen, right? Now, this happens to both men and women. So the more fat people have, probably the higher estrogen levels you're going to have. And then also obesity in itself leads to decreased levels of sex hormone binding globulin, and which binds to estrogen and progesterone, which makes it inactive, right? So having less of that sex hormone binding globulin makes you more likely to have risk factors for increasing fibroids. Family history and genetics, definitely, I think they did twin studies on this, and twins, if one twin has fibroids, the other one's more likely to do it compared to non-identical twins. Women who have a first degree relative with uterine fibroids tend to be like 2, almost 3 times increased chance of developing fibroids also. The dietary habits, I mean, me and we can name off the diet, right? It's like the standard American diet makes it worse. So the more red meat you eat, the more sugar you eat, the more alcohol you drink, the more problematic it can be for fibroids. Hence, when you eat those, that displaces the better foods like vegetables and whole foods. And so you eat fewer vegetables and fruits, and then that also increases your risk of developing fibroids. So a high plant-based diet decreases your risk on that. And it's not one of these, I mean, I guess the studies on this is a correlation thing where they're saying, okay, well, we see people that eat a high plant-based diet, it's correlated with them having less problematic fibroids. But it also does it in a direct way. And one of the direct ways it does, the more vegetables you eat, the less you will aromatize testosterone into estrogen. So part of my natural treatments is I give natural aromatase inhibitors for people who are, have uterine fibroids. Another risk factor.
What are some of those, really quickly, Keoni?
As far as what
the natural aromatase inhibitors?
One of them would be
these are pills, or these are typical diet, like add this to your diet.
Right. We could talk about the specific foods, and I could talk about the supplements. The specific foods would be any vegetable has high amounts of these aromatase inhibitors, or can decrease the amount of testosterone going into estrogen, would be the cruciferous vegetables, and they're all in the same family. Broccoli, cauliflower, bok choy, cabbage, broccoli rabe, all of those tend to do it. But you get it with your green leafies and all that, you're getting a little bit of that. So a high plant-based diet just helps. You can think about eating a plant-based diet as just balancing hormones. And that's what it does. Whereas a diet that's high in red meat, a high alcohol diet, high sugar diet, just gets your hormones out of whack and just causes problems, especially for uterine fibroids.
That's a really good, simple way to put it.
Yeah.
All the more reason to go to the Wellman's Podcast Instagram. Go click the link in our bio, get your The Wellman's Podcast salad PDF right there. Make that your anti-aromatase inhibitor. Boom.
Yeah, no, you're exactly right. That salad is great for many reasons.
Yeah.
But yes, that salad is, yes, we could call that a uterine fibroid inhibiting salad, if you will.
We
So
got to work
anyway,
on our titles. Good God.
I know, right? Yeah. But so this stuff all goes back to like healthy lifestyle, right? So
Right.
so if you're eating a diet that is just poor, standard American diet, then you're likely going to have high blood pressure. High blood pressure is another risk factor for increasing the likelihood of fibroid development. Um, and when you have high blood pressure, what it does basically, or the mechanism of action they think is going on, is high blood pressure causes the body to secrete cytokines in a discombobulated way where the body does not get the appropriate signal, and therefore it causes your sex hormones to go haywire, and maybe the sex hormone receptors to go haywire, and therefore it causes problems with increase in fibroid risk. But there is a correlation there that is seen.
And cytokines are little cleanup cells, right?
Well, no, what I would think about cytokines are just metabolic messengers. That's the way I would think about them. They're just little messengers that your cells secrete in your body, and they're the communication. They help talk to the body, to different cells in the body. So just think about cytokines as metabolic messengers. And high blood pressure tends to
I
cause
can see how it would disrupt those.
yeah, causes problems with that. The cells don't communicate appropriately to each other. Now, of course, we can make that case with anything that's out of whack with the body. The body's trying to always get into homeostasis, and high blood pressure just knocks it further and further out of homeostasis the longer you have it. Other risk factors. Now think about, if you menstruate early. So let's say you're, as a girl before the year, 10 years of age, then you're going to be surrounded and bathed in hormones more so than somebody who has menstruation later on, right? So that could increase your risk. Not having children also can increase your risk. Other conditions, PCOS, polycystic ovarian syndrome, can also cause issues as well. Diabetes, and those two go hand in hand. We'll talk about why that is a problem. We've talked about this before,
We do have PCOS episode.
Yeah, and diabetes, we talked about blood sugar tons, but both of these cause secretion of hormones that it's like insulin or insulin-like growth factor, that will cause fibroids to balloon out. So that's why. So again, controlling sugar is another thing that you can do that, and hence by doing that, one of the treatments for both PCOS and diabetes, first line treatment, is metformin, and metformin has shown to help women with polycystic ovarian syndrome, diabetes, as well as fibroids. And let's see. And then the other thing is age, right? Up to about the age of menopause. So the older you are, the more likely you're going to have fibroids. Up into the age of menopause, what happens at menopause? Then you get this crashing of hormones, right? And therefore, fibroids tend to shrink and are not as problematic as they would be for a woman that's of reproductive age. Well, we talked a little bit about the signs and symptoms, but heavy bleeding, pain, leg pain, back pain, painful intercourse, increased urinary frequency, incontinence, constipation, infertility, all kinds of pregnancy complications are possible with uterine fibroids. So what about diagnosis? Well, I think one of the best ways, besides taking a proper history and all that stuff, is probably ultrasound. Is a really good one because it has a low cost, and it's high availability, so you can get it pretty easily. It's just dependent, on the technician and how good they are for picking stuff up. You can also do the ultrasound, transabdominally or transvaginally, and if they're small, it's kind of hard, but if they're big, you can usually diagnose it with an ultrasound. MRI, it's the second diagnostic option, is especially if there's not certainty, if we're uncertain about the type of pelvic mass that the patient has, it can be more sensitive. So it can really kind of discern whether it's a fibroid or something else better than what ultrasound can do. And then it's also better able to pick up exactly where the fibroid is. Is it submucosal? Is it intramural? Is it subserosal? So, if you probably did an ultrasound and you're going to go in for surgery and maybe just to remove the fibroid, maybe not the whole uterus, then probably MRI is recommended. There are other ways to do it. There's things where you can put like a saline solution into the uterus and kind of expand it. I don't, that comes with a host of other issues. Where you're expanding muscular tissue. I've had a number of women, not specifically with the uterus, but where they did this expanding procedure with the bladder and created tremendous long-term pain after the procedure. So I'm kind of, I just tell my patients, like, let's try to do the most non-invasive procedure we can, and go from there.
Yeah.
Additional tests and would be, kind of maybe a CBC just to see if they're anemic. Fibroids, excessive bleeding caused by fibroids will definitely result in iron deficiency anemia. Plus, women of reproductive age are prone to that anyway, just because they shed their uterine lining every month. So it's something that we may want to look at. A cervical pap smear may be something we want to do. A sedimentation rate, sometimes of keep fecal occult blood, just to rule out other things to make sure there's nothing else going on there. So, what are the main conventional treatments? Besides, we talked about hysterectomy, but there are other things that we can do. And let me just state this also, because we said up to 75% of women can get these, and that's a lot of women. And therefore, with that being said, intuitively, that most women do not need treatment for uterine fibroids. They don't cause any noticeable symptoms for most women, but for a small number of them, they cause severe symptoms. So let me just say that, because I'm sure a lot of women are probably thinking,
that's a great point.
Yeah, they're probably thinking, oh man, probably I have uterine fibroids and go to check. If they're not causing problems, you don't need to worry about it.
Yeah.
You'll know if they're causing problems.
Yeah.
Anyway,
it's like
one of the main
MRI study where it's like 70-80% of people asymptomatic will have, bulging disc here, or all these, abnormalities. I always try and tell people you're not your imaging, and it's pretty much exactly kind of like you're saying that.
Right. Yeah, no, it's funny. Yeah. It's funny you say that. It's like I've seen some images of spines where I'm just like, wow, that looks crazy, and the person has no pain. Whereas then I see a perfect spine and the person has all this pain. So anyway, you know better about that than I do. But
well, we're bad at healthcare doctors as healthcare as a whole is bad at kind of labeling people with a diagnosis, and then
right.
people hear these diagnoses and they may not they don't have the same level of education certainly as the doctor handing out the diagnosis about the situation, and then they kind of sometimes the diagnosis can it labels them forever, right, and they are that diagnosis, and that's just so not the case.
Right. Well, anyway,
and it seems like this is one of them because it's so common.
Yeah. It's very common. And for most women that have mild symptoms, a lot of stuff that we're going to say today, well, even if they have severe symptoms, what we're talking about today should really give them a leg up and help them. So the conventional medical treatments, one of the first line of treatments besides the hysterectomy is gonadotropin releasing hormone agonists, and these are drugs that you like Lupron or Ceneryl, and they're just non-surgical options to help treat uterine fibroids, and they inhibit the production of estrogen and progesterone. That's what you're doing, right? We know the fibroids are very sensitive to estrogen and progesterone, so if we can block that, that's what those drugs do. So they may be prescribed before doing a hysterectomy or a myomectomy, and see if they shrink, and see how the symptoms go with that. So they are a less invasive thing to do. However, they do have side effects, right? So if you're suppressing estrogen and progesterone with these, guess what's going to happen? You're going to feel like you're going through menopause. And if you're going through menopause and you have less hormones around, what are all the things that can come up with that? Hot flashes, vaginal dryness, prolonged use, definitely bone loss. Um, um, so you really don't want to be on them long at all, and so it's just kind of like a brief option that may help. Um,
Okay.
Another treatment is actually given estrogen and progesterone, or progestins, the synthetic form of progesterone, and usually that treatment is just used for people who, they do not necessarily want to reduce uterine fibroids, but they want to take care of the bleeding problems, so that can help with that. But again, it's not helping with the uterine fibroids. Now, a lot of times I've had people where they've done the estrogen and progesterone therapy just to help control the bleeding, and we've done some of the natural stuff, and it did seem to help with their symptoms and get them, just improve their quality of life with their symptoms there. And then there's another treatment called tranexamic acid. Tranexamic acid, yeah. Lystidata, and that stabilizes. It's basically, this is really interesting. I don't know of many people who've used this. I don't know how common it is, but it seems like a really interesting treatment, because what it's doing is it's kind of for those women who have uterine fibroids, who want to maintain their fertility but are unable to take oral contraceptives for whatever reason, and it seems to be well tolerated, and it works by causing blood clots to form within the fibroid, which results in fibroid cell death and eventual fibroid regression. So that's pretty cool. If that, so that may really be something that would be useful. And then there's also NSAIDs, right? So non-steroidal anti-inflammatory drugs, things like ibuprofen or Advil, naproxen, like, and Aleve, and they may help. It's counterintuitive here. They may help reduce menstrual bleeding, and the mechanism is because they lower prostaglandin levels in the endometrial tissue. So they may be able to help with uterine bleeding. So sometimes that may be all somebody needs, especially if they're not that big of an issue. So NSAIDs could be a treatment for it. We talked about hysterectomy. This can be done laparoscopically. It can be done, through the abdomen. I think I think you could even go up through the vaginal wall and also do that. Sometimes a complete hysterectomy is advised, like where you're also removing the ovaries. And I think some surgeons get overzealous with that. Again, it's we're talking about keep your equipment here. I think some surgeons would probably recommend that if there's a family history. If you're not going to be pregnant and there's a family history of, I don't know, any type of other reproductive cancers, that may be something that a woman wants to think about. But again, what you're doing when you do that, you're immediately putting that woman into menopause and taking away her hormones. So there's all kinds of side effects with a complete hysterectomy. So if you can avoid that, I definitely tell people to try to avoid that. We talked about removal of fibroids without removal of the uterus. It, sometimes it helps, but it seems to not be a long-term solution for a lot of women, right? Because the fibroids can grow back if you don't remove the uterus. There are other things out there like uterine artery embolization, and that's just trying to, again, you're doing what that tranexamic acid is doing. You're just trying to disrupt the fibroid by by creating blood clots there, disrupt the blood flow, and with the uterine artery embolization, you're reducing the blood supply to the fibroid tissue also. So sometimes that can help. Again,
Yeah.
this is a short-term, possibly a short-term solution, and it may be recommended for women who want to maintain fertility instead of having their uterus removed. So there are some other emerging things that are coming out. One is selective progesterone receptor modulators, and basically these are drugs that have shown promise in animal models that basically block the receptors or modulate the receptors that would bind progesterone. And based on that, any extra progesterone that's floating around can't bind those receptors and cannot cause a uterus to grow. So selective progesterone receptor modulators may be something that is going to be used more widely soon.
Yeah.
One of the things I use from a natural perspective is aromatase inhibitors, and there are conventional aromatase inhibitors also. Femera is one, and Arimidex is the other one. And these are things that are used for the treatment of like reproductive cancer, breast cancers that are hormone sensitive, estrogen sensitive. So what you're doing is you're blocking estrogen, you're blocking the body's utility of estrogen. So it can cause, again, it may cause some side effects there, but what you're doing is just inhibiting that aromatization of testosterone into estrogen. So you're lowering estrogen, and therefore the fibroids don't have as much of that around. And going back to diabetes and polycystic ovarian syndrome, metabolic syndrome, all of these things are related to high insulin levels or insulin-like growth factors. Insulin-like growth factor is like fertilizer for any type of tumor. Same goes, fibroids being a tumor, same goes for them. And so if you can control blood sugar and decrease insulin-like growth factor, that's another way that you can do it. There's conventional drugs that can actually decrease insulin-like growth factor. So that's pretty cool. But there are other things that you can also do that I'll talk about from a natural perspective in just a second here. I think that's basically everything I wanted to go over there. Is there anything else, Bryan, that I think I missed?
Not that I think you missed, but it does seem like this is going to be one of those, and everything's going to be like this, but certainly going to be leading in terms of, we probably didn't know much about this up until, I don't know, 60 years ago at most. And then
Right.
the treatments are just going to get better and better and more spot on for kind of what's going on there. We couldn't do an ultrasound. I don't know exactly how long ago, but not too long ago, to where we could find these types of things. And
no,
yeah, and figuring that out.
But you know what? By you saying that, it sparked my memory. So another really cool treatment that is coming on the market for removing fibroids is they're using sonography. So they're using like ultrasound, right? In the uterine cavity, but what they're using to treat the fibroid itself is actually radio, they're actually using different frequencies of different radio frequencies that kind of destroy the uterine fibroid, and it's very non-invasive. So that's coming up. So that's pretty cool. It's like, okay, so you can use the ultrasound to basically visualize the fibroid, and if you can pinpoint the fibroid, then you can shoot kind of these sound waves or radio frequencies into that kind of mimic the vibration of the tissue around there, which can break up the tissue, which that sounds pretty neat. And I think it has the advantage, or at least it sounds like it has the advantage over that morcellation technique, where you just kind of blend up the fibroid and then let the body deal with it. Here you would destroy all the cells in there, even if there was cancer there, based on what I understand. So that's a pretty neat thing.
Yeah, absolutely.
It's called Visiblate or Accessa. Those are some of the things that that it goes by, access the system. And I think it's available here in the United States. So it uses that technology. So that's pretty cool.
Yeah, from what I hear, they play this episode of the podcast. That's exactly what plays at these fibroids. Makes them run away.
That's right. We're gonna make them run away. We're gonna make them go away. What another thing is we talked about metformin, right? Metformin is that's one of my favorite conventional meds out there, and one of the reasons why I like it is because it really is a longevity inducing med. Works multiple ways for helping put longer life and quality of life into people's bodies by helping control blood sugar levels, but also decreasing cancer risk. And it also seems to have, like, some of those anti-aging mechanisms seems to upregulate them at a molecular level. So metformin's a really neat conventional drug if you can tolerate it, and most people can tolerate it pretty good. I mean, I think the main thing is GI complaints, and usually it's just brief issues that aren't that bad. All right, so here's my forte. Let's get into it. Dietary, lifestyle considerations, and then we'll go into nutrients and a little bit into Chinese herbs, and hopefully we'll get people out of here before we take the hour up. Diet, what can I say? We've already talked about it, right? Like any diet that's low in glycemic index and low in has a low glycemic load. Think about the Mediterranean diet as being your better diet. Think about the standard American diet as being your worst diet, or a high carbohydrate diet for fibroids. Exercise. This is really cool about exercise because this is one of the few medical ailments that responds to exercise in a dose-dependent way. So basically, the more exercise you have, the more your fibroids will shrink, it seems. So that's fascinating to me. I mean, women who exercise 7 hours or more per week, I mean, I love to exercise. I don't even get close to 7 hours per week. But if people can find the time to do that, the women who did 7 or more hours per week reduce their risk and improve their quality of life as far as the fibroids were, as compared to women who only did 2 hours or less per week. So exercise, big deal.
Yeah, I like that one.
Yeah.
Sounds like this Mediterranean diet's going to become our new magnesium.
Yeah.
We got to mention it every show.
Right. Well, it's the most researched diet, right? I mean, from a conventional standpoint. So it has a lot of it's a plant-based diet for the most part.
Yeah.
Another thing is intermittent fasting. I don't know of any direct studies on this, but we do know intermittent fasting does help balance hormones, does help control blood sugar, helps lower hemoglobin A1C, will certainly help with fibroids, especially if blood sugar is an issue. And it's not always, but if it is, then it will help. And I also want to just throw this out there. I don't want people to think in their head that, oh, well, women that have problems with fibroids eat a poor diet and are overweight. No, I've seen the opposite. I've seen women eat a very healthy diet. I've seen women with low body fat and still have fibroids that are causing problems. So I don't want people to get the idea that,
yeah, certainly,
that everybody falls into that kind of paradigm there. It's just like with type 2 diabetes. Yes, the stereotypical person is overweight, high blood sugar, but I've seen plenty of type 2 diabetics that are underweight, skinny, and muscular. So, All right, so let's get into the nutrients here, because one of these, green tea and epigallocatechin gallate, is fascinating what it does for fibroids. I mean, EGCG is found high in green tea. So drink your green tea, find a good green tea. It's antioxidant, has anti-inflammatory activity. It's anti-tumorigenic properties. It shows significant promise for uterine fibroids. Let's see. A randomized placebo-controlled trial studied the effect of 800 milligrams of green tea extract. And I think it contained like 45% EGCG. That's about 360 milligrams of EGCG. And this was in women, 39 women with systematic fibroids. The 22 women who took the green tea extract daily for 4 months had a significant reduction, 32.6% reduction in fibroid volume, and a significant 32.4% reduction in severity of fibroid symptoms. That's pretty cool, especially
Yeah.
when you are doing something that's not going to hurt you, So you can drink green tea and take EGCG. I think that's really, really key. And then another one that goes especially well in a couple of studies is vitamin D. So if your vitamin D levels are optimal vitamin D levels are between 50 nanograms per milliliter and 80 nanograms per milliliter. Most people don't even get close to 50. The fibroid patients that I've had have been extremely low, almost clinically deficient in vitamin D, and we're really working to get their levels up. The higher the vitamin D level, the less likely fibroid formation occurs. It also inhibits the replication of fibroid cells. It can help shrink fibroid cells if your levels are up, and it seems to be in a dose-dependent way up to a certain extent. Between 50 and 80 is the ideal range. And there have been some studies that look at EGCG with vitamin D, and these things seem to potentiate each other as far as helping fibroids. So, vitamin D and green tea, really, you're not going to go wrong there. It's not going to be problematic for you to take long term, although, you don't want to think these things are completely safe. You can get too much vitamin D and you can get too much EGCG. And so if you're maintaining your annual physical exam and getting annual blood work, you can see things creeping up and getting your vitamin D levels checked before they become problematic. But it's very unlikely.
Right.
All right. So Bryan, can you guess what nutrient I'm going to talk about next? It's an anti-inflammatory.
Yeah, it's gonna be our third new magnesium. Curcumin.
Curcumin, yes, yeah, definitely curcumin. It's a great anti-inflammatory. It decreases levels of fibronectin. That's an important component to helping fibroids grow. It suppresses several growth factors that contribute to fibroid growth, including insulin-like growth factors. It helps with that. And it's a great anti-inflammatory. It's also one of my favorites or most well-researched nutraceutical for stopping cancer, whether it's potential metastatic cancer or benign tumor growth, and it will decrease blood vessel growth. So combining curcumin, EGCG, and vitamin D, those three are like the three amigos right there, with being a very powerful combination without really causing or having to be concerned about too much problem down the road taking those.
Sure.
Almost
Perfect.
no side effects with those. And then another thing that I really like is N-acetylcysteine. And one of the things that green tea, especially when you're taking it at high doses like that for long periods of time, there's some anecdotal evidence it can be hard on your liver. Well, if you're taking N-acetylcysteine, you may be able to stave that off. And then N-acetylcysteine has also been studied as a treatment for fibroids and is shown to help improve hormonal balance and menstrual cycle regularity. It's a very safe thing to take. And I think one study showed women taking it just reported like reductions in the intensity of menstrual bleeding and menstrual pain, with their subjective pain ratings falling. So that's great. And that's a nice thing to take also. That is going to be very easy on the body. In fact, it's good for the body. I take N-acetylcysteine almost every day. So it's good for a number of things. So what about the natural aromatase inhibitors? I'll just briefly talk about these. Diindol methane is one. Chrysin is another one. These are herbal nutraceuticals. Let's see. Gosh, there's some other ones. These are natural aromatase inhibitors. Those are the ones that only come to my mind, but those are pretty important. I use a product called FemGuard for women. who need to take like a natural aromatase inhibitor, and I think it has both of those in there as well as some other herbs in there. And then let's talk about, before we wrap up, let's just talk about the Chinese herbs that I like to use, and I've seen some pretty good results with these. So,
Okay, awesome.
and I know that most, well, of course, most conventional doctors aren't going to even have any idea about
Mm.
any of this. So, so one of my favorite herbs, Chinese herbs, is called cinnamon emporia formula. Okay, that's the kind of the common name, and it's called Gui Zhi Fu Ling. And I give that, and usually I see results after doing a bottle or two of those with, again, we're cleaning up lifestyle stuff, but usually doing that really helps. And it seems in some cases to be more powerful than some of the other products I just mentioned. And then there's another herb, Chinese herbal formula called phlegm transforming formula. Anytime you have like benign tumor in the body, it's basically called in Chinese medicine like stasis or phlegm accumulation. Think about these as like goiters or cysts or fibroids, and basically this herbal formula helps break up the fibroid. And Chinese name is Jinku Hua Tan Pian. But anyway, phlegm transforming formula is the name that I know it by. So that's a good one to use. And a lot of times with fibroids, any traditional Chinese medicine practitioner or doctor of Chinese medicine will know what these herbs are and what they do. And I've had good success with those. Going back real quickly to, we talked about metformin helping with uterine fibroids, controlling blood sugar and insulin-like growth factor and insulin in itself. Berberine is another nutraceutical that kind of acts like a natural metformin. That also may be another way to go. So I think I covered everything. It's funny. This is the one episode, and I should bring it up because, and you actually brought it up. Magnesium can help also. All right. I haven't seen any. Magnesium can help balance hormones. It's very safe to take. Also, it can help with menstrual pain and cramping and also, but the main reason I use it is for the anxiety and just a mild hormone balancing effect that it can have. I didn't see anything specific on uterine fibroids, but usually I include it when I give it to my patients because there's other things going on, and it seemed to combine well with some of the other products we talked about for the uterine fibroids.
Cool.
Yeah. So I don't know if we should talk about anything else. Should I do a review, or are we good? I think we're good, right?
I think we're good.
All right. All
I think
right. Well,
we're
thanks
good.
everybody. Thanks for listening.
Yes, absolutely. I'll give our Instagram another shout out because I'm going to make our thing, Keoni. Or how many, this time we'll ask people, how many times do you think we mentioned magnesium in our post in this episode?
Yes.
So follow us at the Wellman's Podcast on Instagram. We are also on YouTube, all the social medias. Yeah, and then each of us has a weekly newsletter that we put out, and you can subscribe to those links by clicking the show notes below. And I think that's it, right?
That's it. All right. Till next week. See you guys. Thanks for listening.